I am JC Levitt, and this is a health assessment for N495 with Aspen University. So I'm just going to do a head-to-toe assessment on my patient, Roger, here. So, Roger, how you been feeling lately?
Pretty good.
Yeah? Overall pretty good? I'm going to start with your vitals as I just talked to you about some stuff. What's your full name?
My name is Roger Joseph Hermanson II.
Okay. And where are you today?
I am in Billings, Montana at my home.
You know what day it is?
I do. It's Monday.
All right. You liking the weather out there?
It's a little rainy. I'd rather be golfing right now.
Yeah.
But a little overcast and rainy.
Temperature is 97.8, so that's within normal limits. It looks like his oxygen saturation is at 98% and his heart rate is 67. Do you exercise much?
I haven't lately because of the COVID, but yes, I usually do.
Nice. It looks like you're in overall pretty good health. Do you know what your BMI is? Your body mass index?
Well, it was a lot lower before the COVID, so I don't know the number now.
Well, it looks to me like you're doing pretty good body mass wise.
I'm probably 38.
No, you're not.
Okay.
Blood pressure's 140 over 90. So vital signs all look really good. Your respirations are maybe 14 a minute as I count those, so that's perfectly within normal range. So I'm just going to start up here and kind of taking a look at your overall hygiene. First of all, if there was anything, if you were had scabs or dandruff, or if I was concerned about your hygiene at all, I would kind of look into that further. Any pain here? Is it palpate around the sinuses?
Nope, I'm good.
Okay. I'm gonna have you look right at me. Keep looking at me. Sorry.
Fine, I like it.
Yeah. That looks good. Now have you open your mouth. So, oops. Here I'm looking like at his dentation and hygiene again. Make sure there's no sores, lesions, or anything. And as I did that, I kind of saw him before he opened his mouth swallow. That all looks good. Palpate his lymph nodes here and the thyroid. If that was out of whack, you'd be able to feel it there. Okay, can you go ahead and squeeze both of my fingers? Now pull them towards you. Okay, and now push. All right, check your pulse here. It's regular. Take a look at your skin. See if I notice anything weird. You do have a few lumps here and there. Has anybody ever told you or talked to you about these lumps?
Yeah, they're lipomas.
Oh, what's this here?
That's a scar from one I just had removed.
Oh, okay. It looks like it's healing well. Other than that, it doesn't look like any acne or picking open wounds, anything like that. Go ahead and take a listen as you breathe. So as I tell you to, I'll have you take some deep breaths. Okay. Okay, now just relax. His breath sound clear. I'd be looking for crackles, rails, any sort of wheeze, abnormal breath sounds I'd want to really pay attention to. I'm going to do the same thing in the front here, but first I'm just going to listen to your heart rate. So you relax and I'll tell you when to take a deep breath. I hear an S1 and an S2. It's normal. I don't hear any sort of murmur or anything like that. Okay, deep breath. Just two more for me. Okay. At this point, I'm going to have you go ahead and lay down. I'm going to listen to your bowel sounds. And here, listen in all 4 quadrants, upper and lower, right and left. In reality, I should have looked at his skin before listening to it. I didn't do that, but it looks symmetrical. There's no unevenness. It's rounded, not flat or bloated. I'm gonna go ahead and poke around a little bit. You let me know if anything hurts, okay? Does that feel okay?
Feels good.
Even as I go a little deeper there?
No pain.
Okay. Here I could, if his liver was inflamed, sometimes the kidneys, those kind of things I might be able to pick up on. Okay, I'll help you get up there, sir.
Thank you.
As I do so, I'm just kind of continuing my skin assessment. What's this scratch here from?
I was helping my wife's aunt move, and I caught it on a box.
Take a look at your feet here. Again, skin looks good, muscle structure looks good. I'm going to do this on both sides, but I'm going to take your shoes off. Buddy.
Sock too.
Yep. Check for a pedal pulse here. As I do, I'm looking at the integrity of his skin on his feet and feeling the temperature. If they were really cool to the touch, that's something I might want to notice. Do you have any neuropathy, any numbness or tingling in your hands or feet?
No.
No, look at me. What finger am I touching?
It's a toe.
Which toe am I touching?
Fourth one from the right.
Okay. I'm going to scoot back a little bit and put your feet up. It's not funny. Other foot too is fine. Same thing over here. I'm checking for temperature, warmth, sensation, and pedal pulse. Pull your toes to your chest, and I'll push like a gas pedal. All right, strength is equal on both sides. Skin still looks good. Here I might find a popliteal pulse. Have you had any shortness of breath recently?
Only when I try to exercise.
That
No.
happens after COVID.
Yeah.
Any chest pain?
No.
No? When was your last bowel movement?
About 3 hours ago.
That was normal? Was it, do you feel constipated at all or any diarrhea?
No, it was normal.
Okay. How about urination? Any symptoms with urination? Any burning, frequency, pain, anything like that?
Nope.
Okay. Any other concerns you have about your overall health?
My father recently had a brain tumor. Is that something I should be worried about?
You know, it can be. Sometimes those kind of things are genetic and run in families, so I'd encourage you as you reach the appropriate age that you be tested for those kind of things. Just gonna take a look at my notes real quick.
All right.
All right. I think we covered it. I think you're doing a great job taking care of yourself. And I'd like to definitely invite you, if you ever have any concerns, give us a call, okay?
Sounds good. Thank you, Mrs. Levitt.